So, welcome all for this monthly seminar series. And today we are going to talk about very interesting topic called Agni, unfolding the mystery behind the metabolic syndrome. So, there are many of you know me. There are few people who are going to join today. So, let me quickly introduce myself. My name is Vaijayanti Apte. I just go by Jay Apte, and I got degree into conventional and Ayurvedic medicine, integrated degree from University of Pune in 1973. And I also have masters in pharmacology from University of North Texas. So I've been practicing Ayurveda in the US for more than 40 years, and I really had a very good practice. And now I feel like doing a social service and giving what we have. So, offering all these free Zoom seminars so people will understand more what Ayurveda is and how it is going to help us to stay healthy, live longer but healthier, and giving life to our living. And that is my sole purpose of offering these seminars. But always remember, we always say knowing is not enough, doing is. So, whatever you learn in these seminars, unless you follow those instructions, those steps, those guidelines, you're not going to see the results. But as I was talking earlier with few attendees, and they said even making minor changes, you really see profound benefits of that on your health. So I will strongly recommend all of you follow some of these tips. Whatever you can do, start with the small things, but be consistent and continue all those things, and you will definitely see the result, because Ayurveda is the wisdom about the whole nature. This is about for not only for the physical health, but health at all the three levels: physical, body, mind, and our spirit. Okay. I always like to start with a chant. So I want all of you to close your eyes and take a deep, long breath. With each inhalation, balloon the belly. With each exhalation, pull the belly in. Again, inhale, balloon the belly, and exhale and pull the belly in. And you will notice that when you inhale, your whole body becomes tense. And when you exhale, your whole body is more relaxed. So just observe that movement. Now observe the subtle sound your breath is creating. Now observe your mind. And mind always flows with the breath. So when your breath becomes rhythmic, your mind becomes more peaceful and calm and clear. And in this piece, let me chant the prayer of health. Sarvepi sukhinas santu. Sarve santu niramayah. Sarve bhadrani pashyantu. Ma kaschit दुःख भाग भवे. ओम शांति शांति शांति. And keeping the shanti within, gently open your eyes. Namaste, everybody, and thank you very much for connecting today, because today's topic is very, very interesting. and you will really see staying healthy, taking or preventing most of these heart issues, stroke issues, diabetes, and all. What you can do at home, even if you are along with the medicines, if you are taking medicines, I'm not going to tell to stop your medicines at all. But along with it, whatever you learn, and if you follow that, you will definitely see that you will need less medicines, and you can talk to your doctor and ask them to reduce the dose, and the time may come that you don't have to take any pills and all this. Very interesting topic. So let us begin. I'll share my presentation with you. Okay, so today's topic is Agni, unfolding the mystery behind metabolic syndrome. So few of you may know what metabolic syndrome is. Few of you may not know what metabolic syndrome. So I'm going to explain it to you. Okay, so metabolic syndrome is what? It is the cluster of conditions that occur together, increasing your risk of the heart disease, stroke, type 2 diabetes, and many such diseases. So the heart, cardiovascular system, our nervous system, brain, our kidneys, and all are very vital organs, because their health is very necessary for not only for our health but for our being, for our living. So what happens in the heart attack and all? See, heart pumps the blood throughout the body, but heart itself also needs some blood supply. So those are arteries supplying the blood to the heart are called coronary arteries. If those arteries are open like this in this picture, you will see the heart is getting enough blood, enough nutrients, oxygen and all, and it will work fine. But the moment arteries start clogging, then it starts getting less and less supply, and those clogging of the arteries start getting it worse and worse. And you will see in this rightmost picture, this whole artery has clogged so much that opening has reduced so much, then the heart doesn't get the blood, and the heart will not function, because if doesn't get the blood doesn't means it doesn't get enough nutrient, it doesn't get oxygen, all the waste are not removed from the system and all that. And then what happens, then arrhythmias or heart issues start happening. And if these arteries completely get blocked, people may get massive heart attack and all. Same thing happens in the stroke also. Like if the artery is narrow, then the brain cells also do not get enough blood supply, thereby lacking in the nutrient and oxygen and all. And these are so vital organs that minutes of less oxygen or no oxygen, they will die. And that's why it is very important that we keep these arteries open and all these organs start functioning well. Even in diabetes, what happens? Many times people complain about diabetic neuropathy, their feet and all, they become numb, they get tingling and numbness and all these kind of things. So, in simple terms, think about this. When your blood sugar increases, the blood becomes like a sugar syrup, it becomes thick. And when the blood is flowing throughout the body, from the big arteries to the small arteries and finally the capillaries, and those capillaries are thinner than our hair. So the blood cannot pass through those tiniest of the capillaries. And if the parts of the body, the distal parts of the body, if they don't get blood, then again the parts start dying, they become numb, they get tingling and all, and finally the blood supply completely stops, and then people may get gangrene and all, could be the complications of the diabetes and all. So it is very important that we prevent from happening all these kind of things and keep our organs very in the healthy state. But the research shows that about 1 in 3 adults have metabolic syndrome. And I have seen in my practice when patients come in their late 40s or even in 50s, everybody is on blood pressure medication. They are taking this losartan, amlodipine, metoprolol. They are on statin drug. They are taking alpha blocker, beta blocker, blood thinner. They are taking pain medication. They have acidity, so they are taking antacids and so many medicines and all that. But that is causing the problem, and finally, these vital organs start getting affected. So it is very important that we pay attention to those. And what are those conditions or the cluster of conditions I mentioned? And those are exactly abdominal obesity, high blood pressure, high blood sugar, high triglycerides, your high LDL, low HDL, and all those blood work when we see get our blood work done, and all these things are out of range, and that causes main of these issues. So, what could be the culprit? And more in recent years, these diseases are happening at the early age. Do you know diabetes? Type 2 diabetes was called adult onset diabetes, and that is happening to even teenagers these days. People in their 40s and 50s are getting massive heart attack, and they're dying because of that. People are getting strokes and all. So it is become, and there are myriad of other diseases also. It is causing the problem. And what could be the culprit? What could be the cause? And the recent human study showed that almost 88% of the adult Americans are metabolically unfit. Even this syndrome also is called metabolic syndrome. And people are metabolically unfit. And the culprit is our diet and our lifestyle, sedentary lifestyle, and eating wrong foods. So these foods, we are eating tremendous amount of food, and we are eating wrong combinations of food. We are constantly munching, we are drinking ice cold drinks and all that is causing us to gain weight, because obesity is the biggest cause of all these diseases also. But these foods are not only making us fat, but they are also making us sick. So it is very important that what we can do. And people are taking the medicine, but still people are having all these issues. Or sometimes you will see the cholesterol and everything is within normal limits, but still people get heart attack and all those things. So what could be the cause? So we are going to tap into Ayurveda and see what is happening. What is our current solution? Is we take myriad of medicines, as I said, for your cholesterol, for heart issues, for blockages, for blood, like a blood thinner, for water pills, for kidney to function right, to lower your blood pressure. We end up taking handful of medicines, but those medicines have become what? The medicines have become our food. But the saying was, let my food be my medicine. And it is exactly happening opposite, that our medicines have become our food. But what happens? Medicines do not solve all the problems. Yes, medicines are important because in life threatening situations, they keep us alive. But only taking the pills do not solve all the problems. And that's why it is very important that what we do metabolically, our diet and lifestyle, those are the key factors. Along with that, if you take the medicines or if you want to prevent those diseases, you can focus more on diet and lifestyle. But even if you are on medicine, but still you need to pay attention to what you eat, when you eat, where you eat, why you eat, and all those problems. Because then the medicines may kill the bacteria, they may block your pain, they may block some channels in the body, but they do not
Excuse me.
heal the body. What heals the body is the food you eat. And that's
वैदिक
what diet and
2-4 जणी जरा ऍड व्हायला बघतात आहेत, त्यांना इन करा मीटिंग मध्ये.
uh, for some reason I am not. 1 minute, let me.
सॉरी तुम्हाला डिस्टर्ब केलं, पण ते
No, that's
मेसेज
okay.
करत होते मला.
Generally, I see here. Yeah, 1 minute.
या
Let me
थँक्यू.
add them. Yeah, there are quite a few. 10 people coming. I admitted everybody. Okay. So, so along with the medicines are not enough. So we need to do. This happens when only one person is handling everything. Sorry about this. So, along with the medicine, diet and lifestyle is the key. So today we are going to see how that is going to help. Okay. So Ayurvedic concept about preserving health, and that concept is called Agni. You know, everything is made up of in this universe by Pancha Mahabhutas. And the Agni is the third Mahabhuta. Prithvi, Apa, Tej or Agni, Vayu and Akasha. And Agni is the Mahabhuta of the transformation, of the change. And we know one unchanging reality about life is a change. And for that change, Agni is very important. And these are different forms of Agni. When we want to do the puja or decorate the house, we have these diyas here. During springtime, once there is some warmth in the nature, all the flowers start blooming. When the space shuttle is taking off, when the space shuttle is taking off, it has to generate so much heat to go into the different state. The sun is illuminating the whole universe. So these are different forms, but they all represent the Agni. So today we will see how Agni is going to help us in taking care of. So in quickly, the journey into Ayurveda is the Veda of Ayu, is the wisdom about healthy living. It's not a medicine. Think about Ayurveda is not the medicine. Ayurveda is the way of life, is the way of healthy life. Because Ayurveda's first goal is to preserve our health. And it's the science of nature. We always call nature the mother nature. And we also say that as above, so below, or yatra pinde, tatra brahmande. So what is in the whole universe? Same thing is in our body. What is in the body? Same thing in our one cell in the body. And think about this. How much is the water on the earth? About 65-70%. How much water in the body? 65-70%. How much water in one cell? 65-70%. So we are exactly a replica of the whole universe. So the whatever three energies, the water, the fire, and the wind, those three energies work in our body too. And Ayurveda's main focus is in staying healthy through diet and lifestyle. And also it is connecting our body, mind, spirit. So we are not only the human doings, but we are human beings having three levels of existence: body, mind, and spirit. And unless all those three are connected, we don't have the meaningful life, we don't have the quality of life. And Ayurveda's first goal is swasthasya swasthya rakshanam, that is preserving the health of the healthy people. That is the first goal. And the second goal is to aturasya Aturasya Vikara Prashamanam. And that means Ayurveda doesn't treat the disease, but Ayurveda treats the person who has the disease. And mainly by taking care of the cause of the problem, because unless the cause is gone, the effect will not wear off. So it is very important that we take care of the cause and treat the person. And let me give you an example. These days, many people have migraine headaches. So there is one pill for the migraine headache, but Ayurveda says why person is getting a headache? Because of his stress in life, or because his body heat has increased a lot, or if he is eating very spicy food, or his anger is kind of making him get the migraine headache. So whatever is the cause, the herbs change, and then the disease gets better because we are always removing the cause. That is mainly the difference between Ayurveda and conventional medicine, how we look at the health or how we look at the treatment part of it. So let's talk about diet and lifestyle today. So we always see you are what you eat. But Ayurvedically, this is only one part of the equation. And it is very important that it is you are what you eat. So what you eat makes a lot of difference. And why food is so important? Because do you know the whole body is nothing but the food you eat. It is called Annamaya Kosha. So think about from one fertilized cell, the newborn baby with trillions of cells, with all the systems developed and all that, is born, and how the fetus grows by the food mother eats. Where does the sperm and ovum come from? From the food we eat. The moment the newborn is born, then it starts sucking on breast milk and then it starts eating the food. So this physical world, physical body in the yoga system, it is called Annamaya Kosha. Everything depends on that. And that's what, like, if you want to build a building, you need cement, you need brick, you need wood, you need glass and everything. Same way, to build this whole body, you need some carb, you need some protein, you need some fat. And why I'm saying this? Because these days, if you have diabetes, completely avoid carbs. If you have kidney disease, avoid protein. If you have high cholesterol, completely avoid fat. So do not avoid anything. That you need to eat at the right amount and at the right proportion and all that. So food is very important because it's a building blocks to the body. And second, in Ayurveda, we also say in the prayer, Jivana kari jivitva, anna he purna brahma, udara bharan no he janize yajna karma. And that's what, for us as living beings, the food is very important. When I say ahara, that is the Sanskrit word for food. Ahara comes into water, air we breathe, the emotions we take, and the food we eat all together. And for that, it is very, very, it is like a Brahman. Without food, we cannot live. We can sustain our life. And food doesn't only nourish your body, but it nourishes your mind. It nourishes also your soul. But Udara Bharan Nohe Janize Yajna Karma. So when we do any puja, when we do any yajna, we have to follow all those steps. We have to do all those rituals the same way. Eating is not a taking a bite. Eating is not while you are working or having the lunch meeting or doing something you are eating. There is the protocol, and I will talk in other top lectures about that. But it is a ritual, and you follow that because for the whole body, food is kind of Brahman. Food is the essence. Then in Sanskrit, Ayurvedic text, it's a beautiful one line, but that makes so much sense. Pathe sati gadartasya bheshajam grahane nakin. So if you are going to follow the right diet and lifestyle, why do you need medicine? And there is only one later added, pathe asati gadartasya bheshajam grahane nakin. That means if you are not going to follow the diet and lifestyle, then what is the use of medicine? Only medicines are not enough. If you want to prevent the disease, you have to follow diet lifestyle. Even if you want to treat the disease, you need to follow the diet and lifestyle. And that's what in sickness or in health, food is our savior. Food is the right thing. And somebody already mentioned that person, doctor had so many health issues. And when he followed his lifestyle, started doing yoga, started eating right and all, he could take care of most of his diseases and he's living very healthy lifestyle. And you all will experience that if you start focusing on that. So that was only part of the equation, what you are, what you eat. But second part and more important part of that equation is you are what you digest. And when it comes to digestion, again in Bhagavad Gita, there is a saying, Aham Vaishwanaro Bhutva, Praninam Deham Ashrita, Pranapan Samayukta, Pachami Annam Chaturvidham. Aham Vaishwanaro. Again, here is a connection to the nature. Vishwata Agni. This Agni is of the universal Agni that resides in our body around the navel. That's where our Manipura chakra is. So when you eat, when you protect that Agni and what it does, Pranapana Samayukta. That means when along with the Pranavayu, Panavayu, Samanavayu, Pranavayu helps us to swallow the food. Apanavayu is going to remove all the waste. Samanavayu is going to kindle the Agni to help to digest the food better, and it is going to digest all that food. Annam chaturvidham means different forms of food. The food you lick, food you drink, food you chew, food you bite. All sorts of different foods you are going to eat. Your Vaishwanar, that is your Agni in your digestive system, that is going to digest the food. And it's not only digesting food, but building all the tissues in the body and making your physical body, making your all the systems. cardiovascular system, respiratory system, nervous system, uh, uh, emotional, and all that. Everything related to that. So digestion in the body is very complex process. It transforms all kinds of foods and liquids into our bodily tissues and systems. So this body is made up of all the systems. Systems are made up of tissues. And Agni is the one which is transforming the food into your bodily systems. And that's why it is very, very critical. And you have to maintain the quality of that Agni. Anything enters in the body must go through this Agni Pariksha. So we always think that Agni is only in the digestive system, but today I'm going to tell you a little bit more. So here I'm showing you something. Whole digestive system is your esophagus, your stomach, small intestine, large intestine, rectum, and anus. So what happens in the stomach? I have taken these pictures when I was making ghee, and that is exactly happens in our digestive system. In the stomach, the food is kind of made in uniform state. All the foods we eat, like maybe hamburger and cheese and the fries and the beer and ice cold water and anything you eat has a different consistency. It is made of the uniform consistency in the stomach. Then it goes in your small intestine, and there you will start seeing it is literally boiling. So that's where our digestion is happening. And when all that digestion is happening completed in your small intestine, then you can see here I've shown example of ghee. The most pure and transparent form of ghee is ready. So actually whatever foods you eat, it has to get this pure form of the nutrient, and then only it is going to build your body. But many, and that's what we have to protect, this Agni. Think about you are making khichdi at home and you are cooking in low heat. It will take hours, but khichdi will not be digested. If you cook it on high heat, everything will burn. If you continuously change it to low and high, again it will not get cooked. But if you are cooking on the medium heat and all that, it will perfectly get cooked. So same way we have to maintain this Agni in the optimum state so it will digest the food. This is called the physical digestion, and this Agni is named as Jathara Agni because Jathar is the stomach, is our digestive system. It converts all forms of foods into five different Mahabhutas. Okay, so Ayurvedically, we don't say it is the carb is converted into glucose and protein into amino acid and fat into fatty acid, but it converts into five different Mahabhutas: earth, water, fire, air, and space, but they are still in the food form. Remember here, we eat vegetables, we eat all the fruit, we eat carb, we eat protein, we eat chicken, we eat fat, we eat junk food. So everything is still in the food form. It is not in the human form. But then body starts absorbing this. It goes to your liver and all. And then there are other five Agnis. So there are Bhutagnis and there are Dhatu Agnis. So we have five Bhutas in the body. And that's why Prithvi, Aap, Tej, Vayu, and Akash, Pancha Mahabhutas. So every Mahabhuta has its own Agni. And then those Bhutagnis, what do they do? Is they work at the molecular level and they convert food Mahabhutas into human Mahabhutas, because body has to use those human Mahabhutas to build all your tissues. So there are five more Agnis. So remember, digestive system is not only what is happening in the stomach or small intestine, but then for the somebody said
Yeah.
something.
Okay. Okay, okay.
Please, everybody mute yourself so you will not disturb us, please. So Bhutagnis work at the molecular level. They convert food Mahabhuta into human Mahabhutas. But still, tissues are not built yet. Then come the Dhatu Agnis and different tissues. Ayurvedically, we call them Dhatus. And there are 7 Dhatus in the body. Rasa Dhatu, Rasa Dhatu is the fluids in the body or the plasma. Rakta Dhatu is the red blood cells which carry the oxygen in the body. Mamsa Dhatu, Mamsagni, it creates the muscles in the body. Meda dhatu, that is the adipose tissue, the lubrication in the body, the fat in the body. Because body has to function right, so it is well lubricated. We need some fat. Then asthi dhatu, that is the bones. Majja dhatu, within the bone is the majja dhatu is the bone marrow or our nervous system. And finally, the Shukra Agni is our immune cells or our reproductive cells. So after Mahabhutas act on it, then these dhatus act on it. They take Mahabhutas, whatever they need to build all these dhatus. And see how many times that food is cooked. Not only once, but then Bhutagnis work on it, these Dhatu Agnis work on it. And Dhatu Agnis work at the cellular level and they convert human Mahabhutas into human Dhatus or human tissues. So you can see first food is digested into food Mahabhutas, then converted those Mahabhutas into human Mahabhutas. From human Mahabhutas, body is building all these tissues, so creating your whole body. And in the body, this process is continuously happening. We see the creation, sustenance, and dissolution, or utpatti, sthiti, and lay. Utpatti is the creation, building the new tissues, because these tissues are what? They are the energy reserve in the body. They are broken down to create more energy. You know, when people play tennis or they play football and they lose like 10-15 pounds during one game, because all their muscles and fat and everything is transformed into energy, and then they eat the food again and again the tissues are built. So this process is continuously happening. So you can see how complex this digestive process is, and that's why our goal to maintain the optimum state of all these agnis is very, very important. Mahabhuta, again, there is further, I can see how detailed Ayurveda goes. Mahabhuta Agnis along with Dhatu Agnis create Prakriti specific markers on the tissues. And that's why everybody's blood group is different. Somebody may have O, somebody may have A or B or AB, somebody is RH positive, somebody is RH negative. How does body create these different blood groups and all that? So Dhatu Agnis, along with Dhatu Agnis, these Bhuta Agnis work, and they create person-specific tissues in each individual. And this is the reason, do you know, when we do heart transplant, liver transplant, kidney transplant, and body tries to reject because it is different, body feels that it is a foreign tissue, because you are getting somebody else's organ transplant and their dhatu agnis, their mahabhuta agnis are different, dhatus are different compared to your dhatu. Or when we want to have the bone marrow transplant, how many specimens you have to test to find one match? Because as you go down in the hierarchy, this tissue becomes very, very specific. And these agnis, bhuta agnis and dhatu agnis create that specificity in each individual. And that's why it is so important that Agni concept is very, very important. And it is fascinating fact. It takes 1 month to convert food into all tissues. So the food you are eating today is going to make your immune cells. It takes 1 month. It doesn't happen in few hours. This process is continuously happening, and it is very, very kind of slow growing process. And that's what maintaining your Agni in the state, optimum state. I'm emphasizing this on your mind more and more, that it's
I
very,
think there
very
are
important.
people waiting in the waiting room. Somebody can admit them. They can come.
Generally, I get the notification here, but let me do this. Any of you can help me here, be the co-host?
I can help.
I can help also, Dr. Apte.
Who is
Bhanu, if you make me co-host, I can at least help you mute, but I wouldn't know how to admit. I'll have to.
So you will see the admit thing there, and you just click on that so you can admit the people. But
where would I see admit?
You will see on your screen.
Okay, if I'm co-host, I'll be able to see, right?
I know, but I am not seeing you. 1 minute. Let me change.
Okay. BHANU, if you make me co-host, I can help you.
Bhanu, you said that?
Yeah.
Okay. Let me make co-host. Okay, I made you co-host. Now you will, if you see the sign, admit, you do that, please.
Yeah, I see it, yeah.
Okay?
Yeah.
So, good. Thank you. Thank you very much. Okay, so why this Agni is so important? आयुर्वर्ण बल स्वास्थ्यम उत्साह उपचय प्रभा ओजस तेजो अग्नय प्राणश्चोक्ता देहाग्नि हेतुका शांतेग्नो म्रियते युक्ते चिरंजीवति अनामय means our life, our radiance, our strength, our health, our energy, everything depends on the Agni. Because think about this, when you talk about your life, you talk about your strength, what is going to give you the strength is the tissues. Who is going to form the tissues from the food you eat is the Agni. Agni transforms food into your human tissues, and tissues are the energy reserve. That's what I said. You have to have the enough hemoglobin to carry the oxygen throughout the body. You have to have the strong muscles to do any kind of thing you want to do. Your body has to have enough fat to lubricate all the systems so your systems can function right. Your asthi dhatu, it gives support to your body, and it is the reserve of your calcium, and calcium is essential for the muscle contraction, nerve conduction, and all that. So when you need more blood calcium, your bone is dissolved, but you eat food again and your bone is built. So constantly this process is happening, but tissues is your strength, tissues is your health, tissues is your life, and all that. And who builds those tissues is the Agni. And that's why it is very, very important. Tissues are broken down to release energy, and they're replenished by the food we eat. And that's why our strength, our energy level, immunity, vitality, you name it, everything depends on this Agni. So if you ask me, Dr. Apte, one thing what we have to pay attention, I will tell you, pay attention to this Agni. Because even if you don't eat uh, very rich food, that's one from the simple food, if your Agni is very strong, it is going to build strong tissues, strong dhatus in your body, and you are going to be healthy and all. Yes, it is important that you eat organic food, homemade food, and all that. But still, if your Agni is weak, then even organic, homemade, freshly made food is not going to build tissues, because your Agni, the converting energy, the manufacturing machine is not working well. So it will not build the strong body. And that's what it is very important that we pay attention to the Agni. With strong tissues, all the systems function at the optimum level, preventing disease and preserving our health. And the root cause of the most of the diseases, listen to this line, Shantegno mriyate yukte chiranjivati anamayaha. Means if this Agni gets put off, this is almost good as death. But yukte, if you maintain that Agni in the optimum state, then it helps us to live chiranjivati. That is, it will help you live longer, but anamayaha. That is longer but healthier. Right now we are living long, but so many chronic diseases, the heart issue, the stroke, the Alzheimer's, Parkinson's, cancers, and all. So it's not quality of life, but if you want quality and quantity both, then you have to take care of this Agni. It is very important. I hope I emphasize that in your mind. Then what are the causes of impairment of the Agni? And whatever we are doing in these days, in this era, Ayurveda has written that in 5,000 years ago. Ajirnat, Atibhojanat, Vishamashanat. Ajirna means what? Eating the before the previous food is digested. It's all the time. People say, I don't know what hunger is because I eat every 2 hours. because those ice cream or cookies and cakes and nuts and chips and crackers and pita bread and hummus and you name it. There is so much junk food, munching food around that we constantly end up eating and then we get that ajirna. The food is not digested. And then the food sits in the system and it ferments and produces problems. Ati bhojana, excessive eating. Many people like to go to this all you can eat place. There is so much food like and they eat like there is no tomorrow. So all this called vishamarchanat, combining the wrong foods. Asat mein guru shita means combining cold foods, heavy foods, cheesy foods, wrong foods. All those kind of things cause the problem. And then dushyati agni sadushto annam natat pachati lagvapi. And then agni becomes so weak. And then even if you are eating light food like khichdi and kadhi, or just steamed rice and rice and steamed veggies and all, no cheese, no heavy food in it. But still, if the agni is weak, it is not going to even digest that food. This is almost mriyate. If you just shantegno mriyate, that means agni starts putting off and that starts causing all the diseases. So this is our lifestyle. Look at this ice cream scoop. 2 or 3 even we eat at one time. Constantly there is so much ice in our life and ice is exactly opposite to Agni. So it is we do every effort to weaken our Agni and expect to be healthy, but that doesn't happen. Then what happens? What is the effect of that weak Agni? So I have taken the picture here about that we make batter for idli and dosa. If you make it, stop that process at right time, it is good. But if you do, for some reason, if you forget, then it just kind of ferments so much, it starts overflowing and your whole house will start stinking. That's exactly happens when if the food is not digested on time and if the food ferments then it produces the toxin like this and it is in Ayurveda we call ama. Undigested food, foul smelling, very thick, sticky, heavy, that consistency of the food that is called ama. And then Ayurvedically, ama is undigested food which is fermented and having all these qualities. But even high blood sugar, cholesterol, because they also help, hey, they make the clog the arteries, like here I've seen the picture. But those are not the only one. Even your undigested food also starts clogging all these channels in the body. And that's why it is very bad. When we talk, doctors most of the time talk about inflammation. Ayurvedically, that inflammation is ama. Many times these days we are talking about so many autoimmune diseases. Ayurvedically, those are amagenic diseases. Once you start digesting and getting rid of this ama, many of the diseases start getting better. Then what happens if the body is full of ama? Then srotomayam hi shariram. Our whole body is like a channel system. Whole body is a channel system. So think about in yoga, we always say there are 72,000 nadis. Those are in subtle body. In physical body, there are almost millions of miles of channels in the body and blood and nutrients are circulating throughout it. But this ama starts circulating throughout the body and because it is very sticky, it is very heavy and all, it starts clogging or blocking many of the channels. So we always look at the heart, your coronary arteries, there is a blockage. Doctor tell us that 80% are blocked, 90% are blocked. But nobody checks all other channels also. But the other channels also get blocked because of this ama. And that's why in Ayurveda, again, what it says, Agni and disease. Rogisyat vikrute moolam agnihi. Mool, that is the root of any of the disease in Ayurveda is Agni. The cause of the most of the diseases is weak Agni, impaired Agni. And that's what if you keep your Agni at the optimum level, you can prevent most of the diseases. What happens when the Agni is weak? Body produces ama. Then ama starts circulating in the body. It starts blocking the channels. Cells are deprived of the blood nutrient and oxygen, and the waste is not removed. So everything becomes so congested. Think about the person whose kidneys are not functioning. That person becomes so, he starts retaining water, his whole body swells up, he looks so lethargic and all that. So that's exactly everything happens when this ama circulates in the body and clogging the channels. And cells can function right, and that is the beginning of the disease. So it's not only your heart or brain or anything. Anywhere the channels are blocked, you will start getting those diseases. Arthritis, the ama is blocking channels in your joints. In skin diseases like psoriasis and all, ama is blocking channels in your skin. In your retinopathy and all, it blocking those capillaries in your eyes, in your kidneys, in your extremities and all that. So wherever it starts blocking the channels, that is the beginning of the disease. So Ayurvedically, weak Agni is the cause of the most of the diseases. Whichever channel is blocked, body shows symptoms of that system. Again, you will wonder, what are the signs? How would I know that my body has ama? Srotoro the balabhronsha, gaurav. It's so fascinating that Ayurveda has written all these verses 5,000 years ago, and they are even true today. It's so fascinating. स्रोतोरोध बलभ्रंश गौरव नीलमूढ़ता alasya apakti nishtiva malasanga aruchiklama. That means the whole body swells up and the person becomes so heavy and he feels fatigue and he sits down, and then again that becomes like a vicious cycle because sitting down, sedentary lifestyle again makes him gain weight, and again he feels heavy and sluggish. So that gets into that vicious cycle. Then person get constipated, gas and bloating, he feels very tired. Look at this person's tongue. The tongue should be completely pink, but see how much scum there is. Just looking at the tongue, you will know what is happening in the whole digestive system. Everything is clogged in his body, so the tongue is very white and all. Even if scrape the tongue, that white coating will come unless he improves his agni and takes care of that. So because there is no white coating, there is no taste, because taste buds are all blocked because of this white scum. Then malaise, and he feels kind of he's tired and sick, doesn't have energy. So these are all the signs of the ama in your system. So I have here one questionnaire, and whoever is interested, I will forward this presentation to you. So you can go through this questionnaire and see if you have ama or if you don't have ama. That all depends on that. So how I talk so much about this Agni, then how we can take care of this Agni, how we can strengthen the Agni. The first thing is to delete ice from your life. As I told you, one thing you can do to your health is preserve your Agni. Keep it in the optimum state. So what one thing you can avoid is do not eat anything ice cold, food or drink or anything. Delete ice from your life, because Agni is hot. Ice is cold. It is exactly opposite to Agni. And that's why it kind of works exactly opposite and weakens our Agni, and Agni gets puts off, and that causes the problem. But think about, you go to the restaurant. First, what do they serve? Ice cold water. Then again, you get ice cold drinks. Then you get the salad, which is also very cold. Then you eat very heavy food like cheesy foods and all. At the end, you eat again the dessert. Everything is so heavy. But this Agni, instead of making it very strong, it has become so weak. So it doesn't digest that food. And slowly but surely, it starts becoming into ama. And remember, every snowflake doesn't make a snowball. But one day those snowflakes come and you will see the big snowball having the issue. The same way, little by little, this ama is producing in the body. But when it reaches certain level, you start having issues with those systems. Second thing is stop munching. It takes about 5 to 6 hours for your physical digestion. So if you eat anything in between, it will start causing ama. So do not eat every 1 hour or 2 hours. Wait till 5 to 6 hours in between. People are doing intermittent fasting. They are eating only 2 meals per day and they are losing weight. They are bringing their blood sugar down, blood pressure down. Why? Because they are eating less, less is coming in, and Agni is strengthening, so Agni can digest that food better, and all these things happen. So if you cannot sustain with 2, you can eat 3. Eat light breakfast, good lunch, light dinner, but literally zip your lips in between. Do not buy those junk foods, so you will not end up eating all this. When you see that in the pantry, when you see on the counter those little bit, maybe stick, or maybe nuts, or chips and salsa, or the small piece of cookie or cakes or anything, so that will have the problem. So stop munching. Third thing is limit heavy, sweet, fried, cheesy foods. Every day you're active. If your lifestyle is not very active, then you do not need all these heavy foods and heavy calories. Eat simple food, maybe on the weekend or maybe during kind of special occasions, you can eat all these heavy foods, but don't make it a practice. Another thing important is langhanam. Langhan means fasting. Fasting is very important. Fasting is giving rest to your digestive system. Nothing is coming in. So this Agni gets time to take care of all the leftover food, whatever ama is built up in the body. Agni can take care of that ama, digest that undigested food and all. Even fasting is reducing inflammation in your body. Fasting opens up many channels in the body because Agni becomes strong. Even fasting, even they have done a lot of research, and fasting helps in many chemotherapy, because that chemotherapy, because the channels are opening, the chemotherapy is working better and all that. Fasting has so many benefits. You will ask me, what is the ways of fasting? There are different ways depending on your Agni. If your Agni is very, very weak, then you need to fast the whole day. You can skip the meal the whole day. If your Agni is not very weak, you can skip one meal and maybe eat in the evening. Depending on your state, depending on your prakriti, there are different ways of fasting. But fasting in our culture, old people used to fast, maybe Monday fast, Tuesday fast, Friday fast, whatever. But that all has related to your health. Simple thing, penny, it costs penny, but all these spices, Deepana and Pachana herbs, like ginger, dry ginger, fresh ginger, pipali. In Gujarati, it is called ganthoda. It is also available in Indian store. Black pepper, ajwan, cloves, cinnamon, turmeric, you name it. And there are so many of these spices. They cost only pennies, but their benefits is more than hundreds of dollars. They will strengthen your Agni. Here I'm talking about, don't eat very spicy food that your whole body will burn. But some of these spices are essential for the body to strengthen the Agni and digest the food. Please mute yourself so you will not bother other people. Thank you. Then exercise. Exercise also creates a lot of internal heat. That also helps to open up the channels in the body and all. So in your daily routine, you can do different kind of exercises. It could be aerobic, you can swim, you can jog, you can run, you can dance, you can do yoga, any sorts of exercise, but some exercise is essential. Pranayam, Kapalbhati pranayam, Basrika pranayam, you are doing forceful breathing, and that exactly happens, movement happens around your navel. So all your digestive organs, your liver, your pancreas, your spleen, your stomach, small intestine, everything gets stimulated. This Agni gets kindled, and it helps to strengthen that Agni and take care of many of the issues. Taking Triphala at night, because many people are constipated, and if the constipation, everything kind of get stagnated in the body. So when you take Triphala and when you get good bowel movement, many people say that when I get good bowel movement, I feel very hungry, because that also kindles that Agni. And I told you in the beginning, prana, apana, samayukta. So apana vayu, when you take Triphala, apana vayu is functioning well, cleansing the body and strengthening the Agni. So you can see these are simple ways. They do not cost you anything. Or maybe the spices may cause you pennies, but that will help you to prevent the metabolic syndrome or any kind of disease, and even if you are on medication for those diseases, if you do some of these ways to strengthen your Agni, you will be amazed by seeing that your blood sugar will come down, BP will come down, swelling will go away, your kidneys will start functioning better, you will start feeling more energy and all, because everything happens because of weak Agni. And here, with these kind of tips, you are taking care to strengthen your Agni. Here are few combinations and they are very favorite. In Ayurveda, two things, three katu, and it's the combination of three pungent. And three pungent means very hot. Ginger, black pepper, and pippali or pimpli or ganthoda. And combine all these three powders together. You get these in Indian grocery store. And combine these powders together and take only quarter of a teaspoon after your meals with honey, or you can take it in ghee, but only quarter teaspoon. But this is kind of throwing that strengthening your Agni, and your Agni will get kindled and it will digest your food better. Or sometimes we call in Marathi pachak, that is the mixing of the fresh ginger, lemon juice, pinch of salt, and 1 teaspoon of raw sugar. You combine everything together and it tastes wonderful. You take half a teaspoon of this juice before meals. If your Agni is very, very weak, if your tongue is white and coated, you have the swelling on the body, then start your meal with this half teaspoon of this juice and you will really see your Agni will become strong and you will be able to digest better. This simple ajwan seeds, again, you get it for pennies, but they also strengthen your Agni like anything. So after your meals as a mouth freshener, you can take pinch of that ajwan and eat every day after your meals. That will also strengthen your Agni, that will kindle your Agni. And Triphala, as I mentioned earlier, Amalaki, Haritaki, and Bibitaki is the combination. So you take half teaspoon of Triphala at night, at bedtime, so that will help you to have good bowel movement. So these two formulas, Trikatu and Triphala, are the most popular formulas in Ayurveda because everything depends on the Agni and it helps to strengthen your Agni, to kindle your Agni. Even in the treatment, Ayurvedic word for that is called Kaya Chikitsa. And Kaya Chikitsa is this Agni Chikitsa. We always go back to these three doshas and this Agni. Is that important? So what you have to remember? Agnim Sadarakshet. Always take care of your Agni. Agni is the key factor in your health. So try to protect that. Optimum Agni helps to prevent the risk factors of metabolic syndrome and many other diseases. That is your high blood pressure, high sugar. If you follow these things to keep your Agni strong, you will really see your sugar, blood pressure, cholesterol will be maintained. Avoid icy cold things, foods, fast once a week, eat only 2 or 3 meals a day, avoid munching, do pranayam. It is, I am reinforcing all these things. Take pachak before meals, take trikatu after meals. So in short, what you do is take care of all these tissues and dhatus and systems and Agni and energy and giving life to your living with Ayurveda. So that's what I wanted to share with you, how Ayurveda looks at all this disease process and Agni, and how simply taking care of the Agni will help you prevent most of these serious issues. Okay? So
Dr.
that's what I
J,
wanted to
one
share. I will,
question. The last
I'm
point you
going to
said,
stop. I'm going to, 1 minute. I'm going to stop sharing. Now I will answer all the questions.
no, the
Go ahead.
last slide you
Yes.
mentioned in Hindi, the take 3 cut 2 and one more thing you said after me, before
Triphala.
me. Oh,
Yes. Let me just show you that slide. 1 minute.
thank you.
Okay.
Yeah, the last one.
Yes. Yeah. Trikatu and Triphala.
Okay.
Trikatu is 3 pungent. That is ginger, black pepper,
3
and
cut 2 after
pippali.
the meal and then triphala at night. Next slide,
Triphala at
please.
night.
Next slide.
Pardon me?
Next slide. Next slide.
You said pachak before meal. So what is pachak?
Pachak.
Oh,
Okay.
yeah.
This pachak, you can make it at home. It is the fresh ginger,
Oh, okay.
lemon juice, pinch
Oh.
of salt, and raw sugar.
Okay, that is pachak. Okay.
Pachak. Yeah.
Thank you.
Okay.
Dr. Apte, how do you take Triphala?
You take these days tablets are available, or you can take half teaspoon with warm water at bedtime.
Okay, because I have a powder, Triphala powder, so I can
Yes, you can take it half teaspoon of the powder at night.
Okay.
And here is my contact information, my phone number, my email address and all. So if you want to get hold of me, you can take a picture of this slide. So you will have my number.
Okay, another question. The Triphala,
Yes.
how do you take it? Suppose I eat my dinner at 7. And it's soon after dinner I can take, or along with the dinner, or after the dinner, wait for a couple of hours.
I would recommend you to take 3 katu, that is ginger, black pepper, and pipali. Take right after your meals.
Okay. What about Triphala?
Triphala, you take it at bedtime.
Oh, bedtime. Okay.
Because it works, it takes 8 hours to work. So in the morning, you get good bowel movement.
Okay.
And another good part of our Triphala, it is not habit forming.
Oh, really?
So you
Okay,
can take it for months and months.
Yeah, I was about to ask you that, whether you get conditioned to do that. Okay.
Yes, it is not habit forming. So you can take it, a lot of people take it depending on different season. During springtime, they take it with honey. During springtime, summertime, they take it with cool water. And during fall time, they take it with warm water. So depending on the season, you can take, but Triphala is very safe.
Okay.
Doctor, is it safe to give Triphala to children?
Yes, depending on, not to the newborn, but if they are like 5-6 year old, definitely you can give them quarter teaspoon.
For adult, it is two tablet.
Pardon me?
Adult, how much you should take?
Half a
Triphala.
teaspoon. Half a teaspoon. Half teaspoon at bedtime.
Suppose it comes in a tablet, what do you do?
Then take 2 tablets at bedtime.
Okay, thank you.
May I have the questionnaire, please, Sushma Yeravdekar? Yes, you email me info@dfwveda.com and I will forward the presentation to all of you. And I will also send you the YouTube link. So YouTube link will have all this. Okay.
Wonderful. Thank
Just
you.
send PowerPoint to me.
Good evening, Dr. Apte. Dr.
Yes.
HDL कोलेस्ट्रॉल जो है वो कैसे बढ़ाया जा सकता है? वो मेरा नॉर्मल उस पे रहता है.
I cannot hear you.
HDL जो है कोलेस्ट्रॉल, उसको कैसे बढ़ाया जा सकता है?
HDL cholesterol.
HDL कोलेस्ट्रॉल.
LDL cholesterol और HDL cholesterol.
LDL तो मेरा ठीक है. HDL नॉर्मल.
हाँ, तो पहले तो तुम्हारा ये अग्नि स्ट्रॉन्ग करो. I gave you lot of tips, and there is one Ayurvedic formula called Triphala Gukul, and that helps to increase the HDL and lower LDL. But first try these the tips I gave you for the Agni.
Okay, thank you.
Okay.
Thank you.
Hi, does the intermittent fasting works?
Intermittent fasting works for many people. Depending on, you can eat only 2 meals or 3 meals, but stop eating in between. Because if you are, it takes 5 to 6 hours to pass the food through your digestive system. So if you eat anything in between, body is not going to digest. And body has its own clock. That's what Ayurveda recommends. Eat light breakfast, good lunch, light dinner, or eat only at 11 o'clock your lunch and eat 6 p.m. your dinner, and that's it. And somebody reminded me, there is also one thing that if you eat once a day, you become yogi. If you eat twice a day, you become bhogi. And if you eat 3 times a day, you become rogi. So the point is, you eat less in your system, add less food in the body, and you increase your physical activity. But we are doing exactly opposite. We eat a lot and we have a sedentary lifestyle. So what happens when you eat the food, it builds the tissues, and those tissues are not utilized. They don't break down into energy. Then they stay on the body. And then people are taking like so many toxic drugs and things to lose weight these days. Instead, you eat less and improve exercise or have active lifestyle and strengthen your Agni. That will help you a lot.
Excuse me, Dr. Apte. So I want to send you, how should I send my email to you to get the copy of the
info@dfwveda.com.
Huh?
How to take Triphala at night along with food at what time? No, as I said, take it at bedtime, and 2 tablets or half teaspoon of Triphala at bedtime. Can you please send me the link? Thank you, Dr. J. Thank you. Thank you.
Dr. Apte, my name is Priya. I have a
Yes.
question. So,
Yes, Priya.
does intermittent fasting work for diabetic people?
Get
Like,
ready.
because
Go.
they have to eat at a certain.
No, you have to be careful. Okay, you have to be careful about your blood sugar and all that if you already have diabetes. But if you monitor your sugar and eat, only a lot of people are doing that, and they're bringing their sugar down because of that. Because do you know, even if you don't eat in between, your liver stores sugar in the form of glycogen. And when you, after 2 hours, when your blood sugar comes down, your glycogen is converted into blood sugar by the hormone called glucagon. But we never let that glucagon act, because even the metformin blocks that channel, that process. And that's why we end up eating every 2 hours or something. But if you maintain that, you will see your sugar comes down. But monitor your sugar.
Okay.
Don't be just on your own, okay?
Okay, yeah, because so far we heard is, oh, we have to take medicine, so we have to eat. We are diabetic, like, you know.
Exactly. And do you know, let me, I wanted to share this with you guys, that people always talk about insulin resistance, right? So insulin resistance is what happens. The cells do not respond to the insulin. But let me tell you what happens in the cell. Suppose you want to fill the gas in your car, in the gas tank, and you've completely topped it off. And you go to the next gas station and you try to fill the gas again in your tank. Will it be your tank will hold any more gas? No, because it is already tipped. Same way, your cells are so full with glucose, you are not utilizing that glucose as an energy, then the cells are not going to open the door for more sugar, because cells are already full with
Correct.
sugar. It is your job to do the exercise and empty those cells, so cells will open and they will take more sugar in. But if the cells are completely full with sugar, how are they going to open the door for the insulin? And what do? We give more insulin. We give more things. Instead, if you watch your diet and exercise more, exercise is the key. This body is developed to be very active, and which is not happening at all. So if you start walking, maybe walk 15 minutes, half an hour, 2-3 times a day, or do some aerobic activity, you will see your sugar will come down and your cells will also not be resistant to insulin.
Thank you, Dr. Apte. Thank you. That was very informational. Thank you.
Yes. How to avoid
Thank you, Doctor.
avoid gas. How to avoid gas in the body. And that is mainly if you have good bowel movement, you will not get gas. Or if you're still burping a lot, having gas, then try this Tricka-2. Tricka-2 has helped many people. Even when people have heartburn, acid reflux, and what we do, we take antacid. But I give a lot of my clients this Tricka-2, 3 pungent, and their acidity goes away, because all that sour liquid is undigested and it comes up to their throat or in their mouth. But if you strengthen their Agni, their acidity also goes away. Also, if someone does not have constipation issues but some loose stools, okay, in that case, you can give definitely the ginger. Ginger is also a little bit grahi, we call grahi, that is makes the stools a little solid and it improves your digestion. You can try a ginger, Tricka-2 in that person. What if someone is trying to gain weight? They fast intermittent fasting. If you want to gain weight, that means you want to build more tissue on your bodies. So you strengthen your Agni and eat what you are pay attention to what you are eating. So you are bringing in the raw material and you are strengthening your Agni, and you will start gaining weight. Also, someone does not have constipation issues, loose stools. I talked about that. So looks like I have answered all the questions. I hope you found this seminar and this thing informative. So
प्लीज
follow
डॉक्टर आफ्टर
tips.
प्लीज वन मोर क्वेश्चन। मैं
Yes.
हनी नहीं लेती तो त्रिकुटु किसके साथ लूं? पानी के साथ? हनी नहीं लेती मैं।
पानी के साथ ले लो, घी के साथ ले लो।
ओके, घी तो लगता है
Okay.
कि ओवर हो जाएगा, पानी के साथ ले लूं।
Everybody worries about ghee, but ghee is the best quality of fat and you need some fat.
Okay.
Another, let me tell you one more thing, that we always talk about carbs kind of spike your blood sugar. But if you put some ghee on your eyes or smear chapati with ghee, then your digestion slows down and it doesn't spike your sugar and it lubricates all your systems. So 2 teaspoons of ghee and some cooking oil will always help you for your body to function well.
For the gas, you should take Tricatu before meal, after meal, or when?
No, for the gas, for improving digestion, you always take it with the meal. After the meal. After the meal.
Okay,
So
thank you very much.
after
Hello,
every meal, should we take Tricatu or once a day?
That again depends on your Agni.
Yeah.
First try taking it only after lunch. And if still your tongue is very white and really indigestion and lot of burping and all those things, then you can take it after lunch and after dinner, both times.
Hey, doctor.
After your last workshop, I've started doing that.
Okay, very good. Very good.
Triphala is working so great for my husband, because he was
Yes,
always
yes.
constipated. Now every day, like he takes a Triphala and he's so happy with it. So thank
Okay,
you.
thank you very much. And see, these are the simple formulas. They don't cost much, but they
Yeah.
help your whole system.
And is alcohol is okay for the diabetic?
डॉक्टर आफ्टर प्लीज, आपने घी बताया आइस में लगाने के लिए, आपने पहले भी बताया था, पर मुझे कुछ अजीब लगा, तो कैसे लगाना चाहिए आइस में घी?
क्या?
आइस में घी कैसे लगाना चाहिए? आंखों में, आइस में आपने बताया।
So liquid ghee, take it in just a little ghee in a teaspoon and warm it up. So the ghee will be liquid, and with your finger, take it on your index finger and put it like a kajal. Put it under in your inside the lower eyelids and gently rub your eye. So it will get smeared all over your eye. And ghee is very cooling, and eye is a pitta element, the fire thing. So it cools down your eyes and it nourishes your eye. Never use heat on the eye. Always use something cold pack or ghee inside or rose water pack or something for the eyes. Always do the cooling treatment for the eye.
Giloy is for what purpose? Giloy, you last time said Giloy, take Giloy tablet or something. That is for what purpose exactly?
Giloy, I had asked for iron.
Giloy is a herb. Its name is Amruta, and that is like a Amrut. It is excellent for all the doshas, all the systems. It also boosts your immune system. It has also proven scientifically in cancer treatment that Giloy is the best herb. It is also available in Indian grocery store these days. So
And
you can take
what
it
about
like water.
Is Giloy in dry form in a herb, or because I looked like fresh leaves on the internet, it shows green leaves, but
Yeah,
so
the Giloy leaves, if you get fresh, that is even better.
No,
but if you don't find fresh, you can take the Giloy powder.
Oh, there's powder. Okay, yeah.
Yes.
Any
Its
tips for
Sanskrit
kids
name is
weight gain?
Gudchi. Its Marathi name is Gulvel. And it's a common, lot of people know it by Giloy.
How much we should take Giloy?
You can take it only quarter teaspoon per day. Do you know these herbs? are loaded with medicinal qualities. So you
Yeah.
don't need a whole lot. You don't need 1 teaspoon
I'm
of that.
taking
You need
daily.
only quarter teaspoon.
I boil in the water. I put the
You don't
powder
have to
in
boil. You don't have to boil in the water. You
Okay.
can just take 1/4 teaspoon with water. You can mix it in ghee. You can mix it in honey.
Okay.
Anything is fine.
Okay.
Any
Thank you.
tips for kids weight gain?
For me,
Kids weight gain, any tips? Any suggestions for kids weight gain?
I didn't. I'm
Obesity,
not hearing
obesity
your
in
question.
kids.
No,
Obesity in kids.
not obesity. Kids weight gain. Kids weight
Kids
gain.
for
To
kids
gain
to
the
gain
weight.
weight.
To gain weight.
It's to gain weight.
Oh,
Okay. For the children to gain weight, again, what I have seen, that digestion is weak. Make sure they get good bowel movement, because generally who want to gain weight is vata predominant, and vata people, kids are very slim, slender, constantly active, and but many times they are constipated. So give them triphala if that is the case. Otherwise give them trikatu, because once you improve their digestion, then body will start building more tissues, and then they need some more amount of carbs and all that, because carbs help to because it has the earth and water element, and that helps to build more tissues. So do that, but strengthen their Agni. So if they're constipated, give them Triphala to strengthen. And I have seen even a lot of people have food allergies, and I just give them 3 Katu, and their food allergies go away. Because what I'm doing, I'm strengthening their Agni. Because that is
Thank
the
you.
case, impaired Agni is the case in most of the health issues and even food allergies.
So we get this Giloy Ghanavati in the Jandu tablet. So 1 tablet, how much you should take? Daily 1?
Yeah, 1 tablet is more than enough.
Okay, thank you. And
Yeah,
evening
neem,
time?
aloe, giloy, all these herbs are very bitter in taste. Bitter is always have the akasha element, and it has the effect on the whole body in less amount, less quantity. So you don't need a whole lot. 1 tablet will be more than enough.
And what is the good time to take Giloy during the day?
You can take it in the morning or at night.
Question, would it cause interaction with other drugs?
Most of the time I have seen that when unfortunately Ayurveda get the last chance. So people are trying everything and they are on many medications and they come to me. So what I tell them, just space the medicines and the herbs at least by half an hour or something. Don't take them together. But most of these things do not cause any interaction. I have been practicing for 40 years and I did not see a touchwood single patient complaining about the side effects because they are taking allopathic medication. No, because the quantity is very less. Like I was listening to one article that clove, one tiny clove, is very digestive. It has tremendous benefits. But then people go overboard and they start taking the clove oil, maybe 1 teaspoon of clove oil and all that. That is almost as good as like 10 or 20 cloves. That excess is not good. 1 or 2 cloves will do their job. If you have allergies, if you want to have something mouth freshener to take care of all the clear your throat and clear your allergies, just keep 1 clove in your mouth. Just suck the juices. 2-3 hours, 1 clove will do its job and your allergies will get better.
How about Jandu Haritakki? 1 tablet, 2 tablet, how many we should take?
Okay, Haritaki is only one part of Triphala. Triphala is 3 medicinal fruits. Haritaki, Bibhitaki and Amlaki. Triphala has all the 3. If you want to take only Haritaki, you can, but Triphala will give you better results.
Okay.
So, Dr. Apte, what can be taken for dandruff?
Dandruff is more of the dry scalp cells. So first thing I will recommend you, just massage your scalp with either coconut oil, Brahmi oil, Amla oil, because scalp is a tremendous heating organ. Constant nerve impulses are passing through the lightning speed. It creates a lot of heat. And that's what coconut oil is very cooling. Amla oil is very cooling. So you can use those oils. But if you have some lesions on the skin, then you need some herb, then give me a call. I have excellent herbs for those issues.
All right, thank you.
How much
What
trifula?
about, what about hair? Hair falling hair.
Yeah. Massage your scalp and give me a call. I have a hair tonic formula that works better for many people. And along with it, Ayurvedically, your hair, your nails, and your teeth is part of the bone. Okay,
Is
and if
trifula?
your
trifula?
osteopenia or osteoporosis and all, you will
Yeah.
lose hair in your old age. If you are in your mid age, then excess heat in the scalp will make you lose hair. So in that case, massage oil and reducing your spice level, reducing your stress will help.
Is trifula available in Indian store?
Yes.
Yes.
Yeah, in Indian store it is available.
How much one should take?
What?
Trifula, how much one should take every night?
Trifula? Yes, you can take 2 tablets or half teaspoon of trifala at bedtime.
At bedtime. And it helps constipation?
Yes, definitely.
Yes.
Definitely.
Okay. Thank you.
It's also it's available in Bob's Temple also.
Yeah. So I've used trifla for many, many years and ordered some on Amazon, and some of them were no good, but Bab's Temple has it. And then Indian stores have Himalaya
Yes.
brand and Jandu and so on. Those are good.
Yes,
Thank
or
you.
Vedic herbs or something.
Vedic
Yes.
herb, okay. Yeah.
Yeah.
Is there any difference between yogurt and curd?
I might take it.
The yogurt and curd is same, but yogurt and buttermilk has totally different effect on the body. Yogurt, everybody says I have allergies and I take yogurt because it's vitamin C and all that. It has lot of good bacteria. But remember, consistency of the yogurt is exactly like mucus and is going to increase your allergies and mucus, kapha and congestion and all that. So don't eat yogurt, and especially if you eat yogurt in the morning, that is the kapha time. So it will make it worse. But if you add double the amount of water in that yogurt and make buttermilk and drink that glass of buttermilk after end of your lunch, you will really see it is called amrut on the earth. So charge or the buttermilk is excellent for your digestion, for your nourishment and all that. Somebody also mentioned that milk is good to drink, buttermilk is good to drink, water is good to drink. So when can we do that? So drink couple of glasses of water right after waking up. That helps you clear your system. Drink buttermilk, 1 glass right after lunch. That helps a lot. And drink warm milk at bedtime. That will help you to sleep sound. That will also help you to have good bowel movement next morning.
So fruit blended in buttermilk, is that okay or no?
No.
You can churn, you can use it in the blender, that's fine.
What about Jeshtamad?
Dr. Apte,
yes,
a lot of people are saying that you should take lemon water in the morning, fresh lemon water.
Yes.
What do you have?
Lemon water is, yes, it's an excellent system. Though lemon is sour, it works like an alkaline in the system. And that's what most of the diseases and all, we always say they are acidic. Our body becomes so acidic. So lemon water is excellent way to start your day. You can drink lemon water in the morning. As a matter of fact, I will also recommend chew that peel. Don't throw away the lemon peel. It is very bitter, astringent. It is good for your system. You can have the piece of that lemon peel.
And
it
you can
clears your
add,
mouth.
do you add a black pepper in it? I mean, they say you have to add black pepper in it. No?
You can if you want to. Again, it is good for your Agni.
Okay.
But not everybody needs that. So plain lemon water is good. Or you can add even ginger in that water. You can add black pepper. You can make the tea with cloves, cinnamon, turmeric, black pepper and all.
Yeah.
If you have more allergies or weak Agni, then that herbal tea, warm herbal tea will help you a lot.
How about haldi? Haldi in the
this,
lemon. Haldi
Honey.
in the lemon.
Adding honey to lemon water is okay?
Yes. You can add, that's what the ginger tea, ginger, lemon and honey. 1 tablespoon honey. You can squeeze half or quarter of a lemon juice and 1/8 teaspoon of fresh ginger.
How
So
about
that will,
taking chia seed for constipation?
you can try chia seeds and all that has helped many people too. Okay, so thank you very much for attending and I hope you learned something new.
Yes,
And
thank-
next month,
thank-
I'm going to talk about seize the sneeze with Ayurveda. That is, millions of people are having allergies during springtime.
Yes.
So how you can prevent or take care of those allergies with Ayurveda, I'm going to talk about it. So stay tuned. And
Thank
if
you,
you
Dr.
any
Apte.
are interested, tell them to email me. So I will add their name in the email list.
Sure.
And also what I'm going to do is I'm going to offer 12 session program class for Be Healthy Ayurvedically. So if you are really genuinely interested in Ayurveda, if you are anything doing related to health, yoga teacher, nutritionist, skin specialist, whatever you are doing, and if you want to learn Ayurveda, I will send you that information, but send me the email that you are interested and I will send you the detailed information.
Yes, I have done it myself too. I'm really interested.
Okay, okay. Yeah, I made put your name in the list. Yes.
Okay, thank you, Dr. Dev.
Thank you.
Yeah.
Okay, thank you and
Thank you very
namaste,
much.
everybody.
Thank you for your time. Thank you for your time.
Thank you so much.
Yes, thank you. I
Thank
really
Can you put,
appreciate
can
it.
you
And
put
have
my
a good day.
list?
Excellent
Can you put
workshop.
my name in the list, Dr. Apte?
Pardon me?
You have to email her.
I have to
Yes,
email
you
her?
can
Okay.
email at
Okay.
info@dfwveda.com.
Yeah, yes, I
So
have
I
got
will
it.
send you the link and the presentation. Okay.
Thank you so much. Thank you so
Can you
much.
share the screen?
Bye-bye.
Can you share
Thank you
the
so
screen?
much.
Can you share the